Good morning, everyone. And just for clarity, I am not James. Unfortunately, as you'll all know, we've had and are experiencing some technical difficulties this morning. So apologies on behalf of ADASS for that. Please don't see this as a reflection of how the rest of the conference is going to be. We, in planning for this, have become increasingly excited about the people who are joining us, the stories, the presentations, the thoughts that they have about the current state of adult social care, but most importantly, how we want and believe adult social care should move forward. We haven't had the opportunity because of COVID, obviously, to spend time together in Yarnfield. This should hopefully give us an opportunity to recover some of the lost time, some of the lost opportunities to discuss matters, some of the lost opportunities to challenge and explore with each other thinking, some of the lost opportunities just to meet old friends and to meet new friends. But let's see how the 2 days goes. I'm going to have the opportunity to wrap up tomorrow, and I hope to be able to, and believe I will be able to reflect on just how good these 2 days have been. So bear with us as we work through the technical issues. Please engage in each of the sessions. Use the opportunity to pose questions, pose feedback, challenge us, but challenge yourselves. So without further ado, let's now move into the first of our sessions, which quite pertinently talks about personalised social care and health. Can you bring up my first slide, please? Thank you. You had a tempting glimpse of the rich panel that have been gathered this morning to share with us a broad range of personal experiences, opinions, and views about what personalised social care and health is, has been, and most importantly, needs to be. Those of you who know me will appreciate I've spent all of my career working either in health or in social care. And when I reflect back, I think I've always tried to ensure that I've delivered the most personalised support to people, that I've worked with people to create stories that are meaningful for them, help people through trauma. But clearly, there is absolutely much more to be done. I left the council a few years back, and they gave me, as part of my leaving present, a picture with some famous accounts of my time there. And I remember there was one picture that said, Jen, come and see me. I want to understand which of your 2 family members I'm putting into the care home. And this was because we'd had a really challenging discussion around what was right for the person. And at that time, we'd had a challenge because we hadn't really understood what the person wanted. So for me, personalised social care and health has to be putting the person at the centre, listening, working with them, and engaging with them. And it's an area that I know you will all be equally passionate about. Before I introduce the first of our speakers, let me just share with you what we believe in ADASS is needed if we're going to move this agenda forward. So first slide, please. We absolutely need to have a clear strategy that puts personalised social care and health at the centre of everything that we do. It's not just a Department of Health and Social Care strategy. It has to be a cross-government strategy. It clearly needs to be funded, but that funding needs to ensure that it crosses Cabinet Office, MHCLG, DWP, and all of Whitehall. Government is working to deliver personalised social care and health, not just one department. Every part of government needs to be passionate and ambitious about supporting people to live the lives they want. Second slide, please. So it's absolutely clear. COVID confirm that, but we didn't need COVID to tell us that reform of the current social care and health arrangements was needed. We cannot, should not, and will not continue as we are. We need reform. We need funding, but we need reform to ensure that that funding has maximum effect. Reform has to be based on the principle of locally determined plans. Those plans clearly need to be integrated, but they need to deliver person-centred, coordinated care and support. Treatment where it's needed and support where it's absolutely required. So the person has to be at the centre, not a professionally organised plan that meets the need of professionals, not a plan that meets the funding requirements and needs of council, but a plan that puts the person at the centre, enabling them to live the life that we want, that they definitely want. So third slide from me. So finally, from me, clearly we know that housing is so critical as a plank for people's lives. So good housing and decisions about housing have to form part of that decision around support. We want people to live at home. We want people to be valuable members of their communities. So therefore, we have to support people to find the place that they will be most independent, that they'll be happy, that they can flex the care and support they have. There's lots of current learning from the homelessness work in the pandemic, but there's also lots of learning up and down the country of how getting this right makes such a difference to people's lives. So enough from me and enough in relation to what ADASS believes. There'll be more about that as we go through the conference. Let's turn now to the first of our panelists, who really doesn't need any introduction. But having said that, let me just tell you, I'm really pleased to introduce Anna Severwright, co-chair of the Coalition for Collaborative Care and convener of the Social Care Futures. Anna is no stranger to talking about the impact care and support has had on her lives, and is really passionate about what it means to get it right, but also salutary about what it means when it doesn't go so well. So, without further ado, Anna, over to you.
Thank you, Stephen. Good morning, everyone, and I'm really glad to be here speaking to you today. In the briefing that I got, I had there were quite a few questions about COVID-19, and I think some of you might have heard me talking before about my experiences. So I've tried to pull out some perhaps learning where the lessons from COVID-19 can show us perhaps where personalised care is going well and where it needs some work, and how we can move forward together. So for those of you that haven't come across me before, I'm Anna. I became more disabled in my 20s and had to admit in 2012 that perhaps I needed some extra help, and started to use social care, and I now employ PAs using direct payments. And initially I was really pleased and grateful for the support. It meant I could have showers again, I could be dressed, my flat was clean. But quite soon in, I realised that actually I was sort of surviving, and that my life had become very, very small and I wasn't living. And unfortunately for me personally, it's been quite a fight, I think, to get some care and support that actually allows me to live in just a normal, ordinary life. For a long time, I had sort of 5 hours of social inclusion, which in your 20s, when you just want to be able to get out and do normal things, didn't really feel like having a life. I also live with a lot of long-term conditions, so I have a lot of interaction with the health service, and find that health and social care is not very joined up. Next slide, please. But during COVID, it's been a new experience to us all. And I want to just start by recognising the hard work and the amazing work that you have all done, and all your teams will have done, and the amount of effort and time that you've all put into dealing with this incredibly difficult and new experience. And to say thank you, really. So thank you to everyone for all you've done. My experience personally, I have been shielding due to medical advice because of all my long-term conditions. It puts me at higher risk. And I have felt pretty abandoned, really, by the system, I'm afraid to say. I've been in and out of hospital, not to do with COVID, I've not heard anything from social care, nothing's really been joined up. And I've just felt kind of quite forgotten in my little flat, stuck indoors all day. I know I'm not alone. I've heard from a lot of people who I know who either are carers for people with dementia, who are really worried about the impact that it's having on their relatives, the isolation and how their relatives will be at the end. Other disabled people who are really scared to go out or who have stopped having PAs because of the fear of COVID. And obviously, we all know that the experience of people in care homes has been pretty difficult. I just want to explain, I do have some slides with words near the end, but the photos that you're seeing, one thing I did do during lockdown, because I've only been out 6 times during lockdown, is I started taking photos from inside my flat of the views outside. So these are views outside of my window. So just to give you something to look at during this. But I do think COVID has shone a light on personalised care. And I just want to look at some of the really good things it's shown us and some of the more challenging things it's shown us. So next slide, please. The first area I want to focus on is community. So I think one of the really positive things it has really shown us with the things like the rise of mutual aid is that there is community spirit out there, and actually communities can self-organise quite quickly. They can do some amazing things, and there is community spirit still there. I think it has been a mixed picture. The new local government network report on mutual aid, it talked about in some areas mutual aid organisations and local authorities have worked really well together, and in areas where it's worked really well, it's where local authorities didn't try and control or take over from the mutual aid groups or make mutual aid groups fit into their box. And I actually think that's a good analogy for personalised care. Often, you know, when I get an assessment, it's how long do you need for a shower? How long do you need for this? It's fitting into the council's template for how I live my life. And actually, my life doesn't fit like that. I might wake up one day and think, I want to do this today, I want to do that today. And there's something about that sense of flexibility and allowing people to determine what their life should look like. But also, I think it shows us that actually strong communities can have a real positive factor for local people and actually help local authorities. And if we work with them, we can have much more positive impact. I think it's also highlighted isolation for some people. So in some areas, we've had that strong mutual aid and people have been really supported. And I also hear really awful stories of people who have felt very isolated, haven't spoken to anyone, and have felt very alone. And I think that's where health and social care really need to work together. We've got personalised care coming through the NHS now. We've got things like social care link workers. But I think perhaps we need to be looking at how, coming out of COVID-19, we enable communities to build that kind of support in the communities to allow people to feel connected. And the other thing it's really shown us in the communities very starkly, I think, is the inequalities that already existed. We already knew they were there. The homeless, disabled people, people of ethnic minorities, people with poverty. And I think social care has a really important role for social justice. And I know there is a session later on in the conference about this. What I would say about those people from different backgrounds and inequalities is often they are the people that are not experiencing personalised care. It's often said to me, oh, well, it's too difficult. They don't understand it. They can't manage a direct payment. They can't do this. They don't understand. And actually, I think that's not that they can't understand it. The problem is that we're not presenting the information in a way that's accessible to them. And I think for personalised care to work, we need to be meeting people where they're at and finding a solution that works for them. It may not be direct payments, it might be something different, but that person will have a view on what they want their life to look like. And we need to be trying to find out what that is and working with them to find that solution. Next slide, please. So my next point was around communication. So I think personalised care can't work without good communication. If someone doesn't come and spend time with me and actually find out about my life and my desires for my life, then how can they provide personalised care? And coming down with a list and asking me, you know, how from a fixed template, how do you have your shower? How many hours do you need to prepare food? Isn't asking me about my life. It's not asking me about my dreams, my aspirations, and just what I want out of life. It's making me fit that mould. And indeed, I haven't heard anything from my local authority except 2 letters that were addressed Dear Direct Payment User. But I do know some areas that have called every single direct payment user to check in on them, check they're okay, offer support, and just reaffirm that they're there if they need them. And that difference is really stark but I think really important because it shows that sense of we're building a relationship with someone and we're there to support you if you need us. The other thing I think that's happened around language in this pandemic is the word vulnerable. That's not social care's fault. Everyone has been using this word, the vulnerable, and it's really increased and really quite concerns me, because although I may be more vulnerable to COVID-19, I'm certainly not a vulnerable person, and it builds this picture of us as these frail things that need protecting and we're not empowering, we don't have any capacity, and we need looking after. And actually, I think personalised care is about actually seeing that I am a person like everyone else. I may need extra support in certain things, but we all have needs. We're all vulnerable in certain situations. And it's about going away from that paternalistic model and moving towards that sense of working with someone and getting beside someone. And I think actually social care, I'd like you to sort of fight that sense of this word vulnerable, because often the system makes me almost play up my vulnerabilities. If I don't say, oh, well, actually, I really struggle to do this, I struggle to do that, I won't get the care that I need. And it's almost, some people are almost scared to be able to do new things because then they know they're out. And we need to get beyond this sense of only looking at the deficit and looking at all the things people can do. Next slide, please. Another area I think that we've had is COVID has shown that there is real flexibility in the system. So we are doing things massively differently to how we used to do things in a very short scale of time. I know my local hospital, for example, I used to sit in meetings with them, and they would, for about 5 years, we've been talking about doing online virtual consultations, and it couldn't happen because of this and that, and suddenly within about 3 weeks, every consultation outpatients was by phone or video. So things can change really, really quickly, and I think that's a really positive thing. And I think we need to keep that kind of can-do attitude and look at really different ways of doing things, and not just saying, well, that's how the system always was. And have a sort of proactive attitude. So some areas I know for direct payments, for example, have put in a 10% uplift for all people, or they've put in a contingency plan for every single person with direct payments. They provided PPE for all the PAs, and other areas haven't done any of that. And I suppose for me, it's that sense of being proactive and not just waiting and hoping that nothing bad happens and that someone doesn't hit a crisis. And for personalised care to work, I think we do need a sense of prevention. We need a sense that actually, if you help me now to lead a really good life and have a sense of well-being, I am less likely to hit a massive crisis in the future. I'm more likely to be able to go out into my community, feel well, feel happy, feel part of life, and actually be contributing back to society. So next slide, please. I actually think a lot of these different elements and a lot of the areas where we've struggled to get real, genuine personalised care and real, genuine choice and control for people come into things like trust and power. I don't feel trusted by my local authority. I get a lot of letters that have threats in that if I do not return this form within 21 days, my direct payment might be stopped. I have to rationalise absolutely everything that I do with my direct payment, and I don't have much flexibility about how I use that direct payment. I can only use it for PA hours. And I don't think that was what personalised care and direct payments were set up to do. I think they were set up to give people genuine life, just a normal life, an ordinary life. And that is what I think everyone would want. And I think trust and power are really key to relationships. And I think all of personalised care needs those strong relationships, strong with the communities that they serve and strong with citizens. And that ultimately allows for co-production. And I do think that if you are not setting up your services and involving the people that use your services in the design of them, then inevitably they're not going to actually meet the needs of your communities in the best ways possible. So next slide. Can I have the next slide, please? Oh, I don't know if you can actually see that very well, sorry. This demonstrates some of the sort of key shifts, really, that I think we need to see. This actually came from Social Care Futures the other day, and some of it, I think, has been really demonstrated by COVID. Things like caring about each other. Mutual aid groups have really shown that actually there is community looking out for each other. And it talks about social care being a vehicle for a really good life. And I think that is what we need to really focus on, looking at people as people with gifts and potential, And talking about
Hello?
citizens, we're all invested in social care, and somehow breaking down this line of the system and the people that need it, and actually seeing it as a whole community asset and as part of people's wider lives, as Stephen mentioned. You know, I can't split my health from my social care, from my benefits, from all of this. They all come together to form my overall experience of my life that day. But actually, the system insists on me speaking to different people at every step, and that system not being joined up, and often working almost against each other in how I've experienced my life. And then finally, my final slide is just to say, really, that I think we've seen that we can accelerate change, and I hope that actually around personalised care, we take this moment in time and we say, right, we all need to work together now. We all need to accelerate the change. Sorry, can I have the next slide? Towards this vision, because I think ultimately this sums up what I want for my life. I think this probably sums up what you would want for your life, for your parents' life. And actually, just because I'm disabled or someone is older or someone has a learning disability, I think we all deserve to have this in our lives. So we all want to live in the place we call home, with the people and things that we love, in communities where we look out for one another, doing things that matter to us. And I think we all need to really take this moment and see how we can accelerate the change, involving people and communities in that change, to get that personalised care that we really have that vision for and want to see. Thank you very much.